His name ends in a vowel, so he gets automatic entry in the program every time he requests it. Seth, good morning. How are you, sir?
Doing well, Rob. Thanks for having me back.
It's wonderful to have you here, sir. Seth is the Senior Policy Outreach Director of the West Virginia Center on Budget and Policy, and he has great concerns about funding for Medicaid and SNAP as it flows from the federal government to the state of West Virginia. What is the latest on this funding, Seth, that you understand?
So just for the listeners and for everyone in studio today, it's great to be back. And I would propose for folks in the Panhandle that, amongst everything else, happening in the world, this would be a very good week to keep an eye on the House of Representatives in D.C. up on Capitol Hill, because this is the week that we are expecting. Speaker Mike Johnson and leadership have announced that they will do committee markups in an effort to find the money that they have said they are going to cut in order to kind of reenact both the Trump tax cuts, which are, factually speaking, overwhelmingly slighted to the wealthiest households and corporations in the country, in addition to taking a chainsaw, if you will, to federal food assistance to the tune of about $280 billion, at least a minimum, and Medicaid to the tune of a minimum of $880 billion. These are billion with a B, Rob and company. And so these committee markups were supposed to happen last week. It is rumored that several members within the majority caucus in the House of Representatives starting getting cold feet, because one thing that happens with committee markups, Rob, is that there's nowhere left to hide. Once you put the cuts and once you put all this bureaucratic red tape, that they're talking about forcing on working families and seniors and folks with disabilities, once you put that on paper and you vote on it, then you have to own it, right? And so there's been a little hesitation, some would say a lot of hesitation regarding the timeline, things getting pushed back. This is a good week for folks to be paying attention, because the consequences for West Virginia, not just for folks who, receive federal food assistance, count on it, over 270,000 in West Virginia alone, almost 100,000 of them being children. 1 in 3 folks, receive their medical care through Medicaid. I'm sure that includes some folks and care about. It's also, these federal dollars are very important for the ability for everybody to be able to go to the grocery store, the hospital, or the community health care clinic when they need to. So big week on Capitol Hill, a lot at stake for West Virginia.
Is there a time frame when this has to be wrapped up, Seth?
I think that Speaker Johnson, and I chuckle a little bit, I think he is begging for sooner rather than later. I think that, he knows that the longer that this goes on, as everyone, at the station is aware, and I'm sure listeners are aware too, the majorities are threadbare for, Republicans in Congress. They do not have a lot of room for error. And so the longer things go on and the more people have a chance to think about, the number of children on Medicaid and CHIP who would, potentially lose coverage because of burdensome work reporting requirements that their, families have to try and figure out a way to, keep up with on potentially a weekly or a monthly basis or a quarterly basis or something like that. The more people have time to think, members of Congress have to think about the potential consequences of this particular reconciliation bill. I think the more Speaker Johnson probably gets nervous, to be honest with you. So they're doing their best to try and wrap it up. There's a lot of back and forth between the two chambers. I think this is also where the U.S. Senate comes in. Every time the House of Representatives tries to take a firm stance on one thing or another, you'll get a rogue U.S. Senator jump in and say, wait a minute, I'm not voting for that. Go back to the drawing board. And so you've got a lot of back and forth there as well.
Well, there are a couple of senators who have spoken up here and there. By and large, the Senate is, I think, fallen in place pretty much behind President Trump's plans. But in the House, there's about 40 or 50 budget hawks who are not going to sign on to anything until they are certain that there has been progress made on trimming the debt and the deficit. And that could create a huge problem for trying to get any type of Medicaid reform passed, Seth.
I think so. I think that, I think that, congressional majorities, especially in the House of Representatives, are experiencing some serious heartburn. You've got, multiple factions, not unlike what you would see down here in Charleston. You've got, the hard Freedom Caucus, as they are referred to, the very hard right conservatives, cut everything, slash and burn. We've got to take on the budget. But then you've got a much more moderate camp that makes up a significant number of seats as well. You've got folks like Carol Miller and Riley Moore, who have significant percentages of their constituents who rely on Medicaid. To take it a step further, you've got states like West Virginia as a whole, where, significant losses in these federal funding dollars, no matter how they happen, they can be outright cuts, as have been discussed. They can be, instituting a lot of bureaucratic hurdles that families just simply can't keep up with, and they get kicked off, right? It's 6 to 1 or half dozen to the other. And without those federal dollars, you will inevitably see, rural hospitals and community health care clinics start closing their doors, therefore impacting communities across West Virginia. These are things that, and it's not just West Virginia, other states have this conundrum as well to deal with, and I think that their members of Congress would do well to seriously think about that before reaching for a red or green button on this.
Bill Stubblefield.
Good morning, Seth. Thanks for joining us. You've mentioned two programs. There's several others, but you mentioned two, SWAP and Medicare, and I have two questions. First question is, are they both being reviewed by the same committee or the two separate committees?
Outstanding question, Bill. The SNAP program, Supplemental Nutrition Assistance Program, formerly known as food stamps, will be reviewed by the House Agriculture Committee. The Medicaid program will be reviewed by the Energy and Commerce Committee within the House. Energy and Commerce, fun fact, is the longest standing legislative committee in the House of Representatives.
Question is, they're trying to find ways around this, walk around, and one of the suggestions they have is to reduce or at least put some restrictions on the recipients. For example, now there's no work requirements. They're proposing there be a work requirement, and there may be a couple of other things as well. With these restrictions, how much of an impact is going to have on this $880 billion target they're looking at?
Well, I mean, it would be significant. You're talking millions of families, many of them working families, many of them sick and disabled who, technically speaking would be exempt from a work requirement, still get caught up in the paperwork of trying to prove to their local departments or their state departments that they are actually doing what they're supposed to be doing. That's one of the great ironies of work requirements, is that the first people that really get punished and kicked off of initiatives like SNAP and Medicaid are low-income working families and families that are supposedly exempt, right? That's one of the things that I really hope members of Congress are taking stock of. But more to your question, Bill, even the bureaucratic red tape that they're trying to implement, or that they're starting to kind of, the strategic leaks are coming out of Capitol Hill, that's not going to get you anywhere near $880 billion, right? That might get you a couple $100 billion and a lot of people, unnecessarily suffering. But in order to effectuate the nearly, $900 billion in cuts to Medicaid that leadership within the House Republican caucus have said they want, they will have to do outright drastic cuts as well. There's just no way around it.
And John, one quick question, I'll give it to you. And one of the things that's now been proposed, instead of Medicaid and Medicare carrying all this burden, people are realizing the political impact. Now they're starting talking about defense, taking more of a cut from defense. Will this develop legs, do you think?
I really am not sure about that. Now, this is a little bit outside of my area of expertise. I just want to full disclosure. But my understanding is that the potential cuts from defense came from the president himself. And I did see on the wire multiple members, especially U.S. senators from both parties, raise red flags and serious concerns. I do think it's worth saying that if you are truly serious about reining in the national debt, looking very closely at the defense spending, specifically what defense contractors seemingly get away with on the taxpayer dime, is something that you simply absolutely will have to take a look at, to be honest with you. In addition to not passing tax cuts that aren't paid for, that overwhelmingly benefit the wealthy and large corporations.
John Gilstrap.
Do you agree in principle that Medicaid and Medicare are bloated and need to be cut?
I think Medicaid and Medicare are some of the most efficient and solid programs for people to receive health care. So, no, I don't. To be honest with you,
so they're affordable.
Medicaid works. I think that Medicaid and Medicare honestly do better than private insurance, and
not the
provide
question.
People with the health care that they need.
Question is it affordable? America's bleeding to death financially. So, right? So cuts have to come from someplace. Those are among the greatest sources of outflow of money. So are you suggesting, is it your organization suggesting that we set that aside, we don't cut anything from it?
No, I don't think you cut anything from people accessing health care, be it children, be it seniors, be it folks with disabilities or working families, period. You don't balance the budget on the backs of everyday Americans.
Okay.
That's simply not how you come to a moral resolution on this particular issue. The reason we have a budget deficit has absolutely nothing to do with Medicaid or Medicare. The reason, we have deficits are because, we'll start just in the recent history, trillions of dollars was added to the national debt the first time President Trump passed his tax package. None of those cuts were paid for, and they didn't result in any economic activity to help offset the costs. So, if you're really looking to, balance spending versus what we take in on a revenue basis, I propose, and the organization I represent proposes, number one, you really shouldn't do that on the backs of working families and the working poor and people who are vulnerable. What should happen is that people who have seen their personal wealth increase by tens of billions of dollars just within the last 5 years, right? Have you seen the numbers of what these billionaires have been doing since COVID? I think they can afford to chip in a little bit more.
What you're saying, there's an equivalent here that the reason I'm a bit overweight has nothing to do with the dessert I eat. It's the Russian dressing I put on my salad, right? So and by the way, if the work requirements, if we do instill work requirements according to NPR, that's $109 billion in savings. What do you think about removing the coverage for illegal aliens? Is that reasonable?
I don't really know, to be 100% honest with you. What I see from what's been leaked from the package is that the federal government is taking away the ability of states to put up their own money in order to cover certain folks, mainly children, who may be undocumented. And so I think that, number one, I tend to look at what the Energy and Commerce Committee has put out. For now, there have been some releases. The chair of the committee has put some things out, and to kind of take the temperature down on the discussion of illegal alien versus undocumented. What I see from a strict policy decision is that the federal government is trying to barge in and say, okay, states, you can't do this with your money anymore.
Well,
essentially, that's going to impact kids.
I'm going for a principled argument here.
I don't know where you draw the line.
I'm asking
strictly on things that hurt children.
You can probably extrapolate.
Hey, you guys can't keep talking over
You can probably
each other.
extrapolate where I stand on this, but it starts with illegal. Are you supportive? Do you think American tax dollars should be going toward the health care, free health care, the paid for health care for illegal alien people who crossed into America, jumped to the front of the line illegally? Should we be paying for their health care?
I simply just don't think it's that easy or simple a question to answer with a strict yes or no, John. I really don't. And I think it absolutely caters to, an argument that has people, looking at cuts that just simply aren't necessary or right for that matter. I just, it's a lot more complicated when you think about how many people in this country are working undocumented and paying a ton of taxes, right? The people who are picking fruit, picking vegetables, doing construction, working in chicken plants all over the United States. Most of these people may not have their necessary paperwork in order, but you can rest assured they're paying payroll taxes. They're paying quite a few of them.
Another controversial solution, I guess, proposed solution to this is actually to have enrollment into these programs every 6 months instead of annually to requalify. What do you think about that?
I think it's a bureaucratic mess. I think we've tried it once, and here's the practical implication. Right?
Hey Seth, when did we try it previously?
So basically, in practice, once the state of national health emergency ended after COVID, several 100,000 people had to requalify for Medicaid. Right. So we have a little practice in basically sending hundreds of thousands of people kind of through a bureaucratic maze in order to hold on to a benefit that they are qualified for. And the natural conclusion is, number one, our Department of Human Services God love our caseworkers and God love the state workers, but they are cut to the bone. They are stretched impossibly thin, and they simply don't have the bandwidth to try and undertake that amount of bureaucratic processing all at one time. Oftentimes, families they miss a letter in the mail, or they don't get notification the way that they're supposed to. And what we have seen is that a significant percentage of the folks who were removed through the requalification, once the national state of health emergency was ended, right? This was, I want to say, beginning of 2024. It was the wind down. You know, a lot of people were removed from Medicaid who were perfectly qualified for it. And so again, you know, what we're talking about here, I think, is just, you know, extra paperwork that, as a policy, really isn't designed to cut back or trim back on anything. The only thing it really serves is to kick qualified people off of Medicaid. And I don't look at that as savings, really.
Seth, do we know what percentage of people on Medicaid work? Those who are eligible to work? Obviously, an 11-year-old's not going to be able to work, but those who are eligible to work.
I don't want to quote it right off the top of my head nationally and in West Virginia. What I can tell you is that most folks who can do, especially like within the expansion population, and folks who don't have good reasons. Many are disabled. Many are elderly. You've got, you know, kids on CHIP and Medicaid. Obviously, they don't, you know, need to. You've also got a lot of folks around the country and in West Virginia who do unpaid caregiving for family members. I'm not sure if, you know, anyone, you know, in studio or in the listening audience has been in that situation, but it's something that happens from time to time. Mom or dad gets sick. You know, I know, you know, several folks that, you know, one sibling will, you know, take time off or quit their job to take care of a parent while, you know, other siblings try to chip in. That sibling doing the caretaking will rely on Medicaid so that they can get to the doctor and get their prescriptions as they need.
Rob, let me take this from a slightly different tact. There's frequently accusations that the Medicare and Medicaid are full of fraud, waste, and abuse. And it may be, but I don't think so. I'm going to give one example, and that's with hospice. I'm on the local hospice board. The bulk of the hospice bills are Medicare or Medicaid. Every bill that we submit is subject to a great deal of scrutiny. We frequently have to go back.
By whom?
By the Medicare, Medicaid office, where the regional office. So it goes. All the bills go to them. They have to look at what we've done, and then they will see if they're justified or not. If we have not dotted every I and crossed every T, they're kicked back to us. So there is a lot of scrutiny on each one of these bills. Now, does that cut across the board with all Medicare and Medicaid expenditures? I don't know. I'm just saying that small slice, there is a lot of scrutiny before the bill is paid.
So I think you bring up an interesting point. I mean, I know that you know, congressional leadership is kind of frantically clinging to this idea that there is just this mountains and mountains and mountains of fraud, waste, and abuse within programs like SNAP and Medicaid. I don't think that you're going to find that from the client perspective. You know, in order to do something that, you have to have something on the provider side, like somebody, you know, a doctor's office or somebody is trying to get away with something from a billing perspective that they're not supposed to, really. And that's, I think, the most important thing to think about with respect to that whole, you know, argument being put forth. Does it? I mean, are there some bad apples out there when it comes to people who bill? You know, are there some bad small retailers out there that maybe do things with, you know, the Supplemental Nutrition Assistance Program that they shouldn't? I'm sure there are. The last data I was shown, had the SNAP error rate pretty low. There's been a lot of progress over the years in making sure that that program runs as well from that side of things as it can. And I think that, you know, generally speaking, you know, you probably would find the same with Medicaid too.
Let's go to our producer, Dylan Bishop, for a moment here. Dylan?
I looked for some numbers on what percentage of people are working that are on Medicaid. There's about 44% working full-time, 20% working part-time, and then when you add up not working due to either caregiving or disability or illness or school attendance, the number of recipients of Medicaid of adult age that are not working only because of retirement, unable to find work, or another reason is only 8%. So there's 92% make up those other reasons.
That's a pretty small number if those numbers are accurate. What is the source of that survey, Dylan?
This is kff.org, their Medicaid watch. This was published in February of this year.
All right, thank you.
I would give Dylan an attaboy later because the Kaiser Family Foundation that he is citing is a very reputable source. So,
All right, so
kudos to Dylan.
my
Nice
next
work.
question filters down to the state level. Seth, obviously the state doesn't have any concrete plans in effect because they're not sure what the feds are going to do. But what should the state be doing right now to prepare for these cuts, if anything?
Well, I mean, I think that any state lawmaker with an interest in seeing their community access to health care preserved should be getting in touch with their fellow federal delegation and just telling them simply no cuts, no harmful changes. That to me is the easiest message for any state lawmaker that wants to make sure, that you're going to have, whether it's, your constituents who rely on Medicaid, like I said, that's 1 in 3 people across the state, or it's just simply the hospital that serves an entire community, right? I can't say this enough, and it's absolutely true. These federal dollars, for every dollar that West Virginia puts up, generally speaking, for Medicaid, we get $3 back. For every dollar we put up for the expansion population, that's the Affordable Care Act, with Medicaid expanded back in the late 2000s, West Virginia receives $9 back, right? These federal dollars and these investments, keep a lot of nurses and doctors and family nurse practitioners employed. One of the most interesting kind of data points that West Virginia has from an economic standpoint is that the best news economically in West Virginia over the last decade and change, Rob and company, came from healthcare. And we've seen more healthcare jobs created over the last, I think, 15 years than really any other sector, any other industry. And for a state that is getting older, and a state that is, also potentially positioning itself to be like the next, potential retirement community, preserving access to, medical infrastructure, things like community health care clinics, Kanawha City Health Center, where I get my care here in Charleston, or the Valley Health Care, clinic in Mill Creek, West Virginia, where I went growing up as a kid. This is important, right? It's not just important if you rely on Medicaid. It's important for entire communities.
Seth, how can people find out more about the West Virginia Center on Budget and Policy?
Our website, I would check out wvpolicy.org. And then if you go to publications, just hold your cursor over that. We have a blog. You'll get a little drop-down menu. Go check out our blog. It'll give you a good kind of smorgasbord of the things that we are looking at, interested in getting into.
All right. Thank you, man. I appreciate your time today.
Appreciate y'all. Y'all have a good one.
Thanks, Seth.
Take care.